Hello, everyone, and welcome to the Doc Talk. I'm your host, Mian. So in this podcast, I have conversation with our colleagues as we discuss professional achievements and lifetime experiences. We hope our listeners will find value in this podcast, where each episode is unique to highlight diversity in career growth, as each guest share their unique and very valuable life lessons. So in the long run, we hope that the podcast will facilitate professional enrichment, be a source of inspiration, and perhaps even stir new innovative ideas that could help us connect professionally and grow collectively. So today's podcast has a theme, digital technology in healthcare, and I am delighted and thrilled to welcome my guest, who's a pediatric immunologist, Division Chief, Allergy and Immunology at Arkansas Children's Hospital, and she's also Director of Telemedicine at the Children's Hospital. Dr. Tamara Perry, welcome to the Doc Talk.
Thank you, Dr. Mian. It's my pleasure to be here. I'm looking forward to our conversation today.
So great. So let's begin. So, for many people, picking up a clinical focus may not be that easy. I personally can tell I struggled initially. So Tamara, you're a clinician. You've made accomplished researcher and also have administrative responsibility. So what are your main areas of interest in clinical research? And secondly, the critical part of the question is actually, how did you choose them?
Well, those are great questions, and I think the main focus of my research and clinical work is around asthma and allergies, food allergies. I grew up having asthma as a child and still have it, so I've always had a personal interest in asthma, but also noticed when I was in my training that I was always drawn to those patients. And I really love taking care of them and seeing how the advancements in medical care has improved over the years. And knowing that when we use those tools, kids with allergies and asthma can have normal lives, they can participate in sports, they can do whatever they want to do and grow up to be whomever they want to be. In terms of how I came about this career, part of it was shaped by where I grew up. So I grew up in the Mississippi Delta, and I was an asthma patient, as I mentioned, and had experience firsthand of knowing what it feels like to grow up with poor access to health care. And so when I, quote, grew up to be a doctor, I wanted to be able to help people who were in similar situations. So my focus on health disparities and poor access was shaped by how I grew up.
Yeah, that's a great focus. So, we've been colleagues for a long time, and I know you have been amongst the earliest adopters of digital health, and at a time when this was really not on the forefront. So in the last maybe 5-6 years or so, you have successfully created a great competitive advantage for ACH by being a very innovative force in digital health, adopting technology, and obviously creating value for your patients. So the question is, what led you to be an early adopter of digital health, and why do you think it's important for our patients?
Well, I think there are several reasons. One, technology is used in every facet of our lives today.
Right.
And healthcare was or is probably one of the, I would say, slowest to adapt technology.
Mm-hmm.
And I just know from my own experience as a mom that kids use technology all the time. They like to play video games. They like to use their phones. And we as adults do as well. So those are great tools that we can use to fill some major gaps that we have in medicine today. We have so many kids and families who don't have access to specialty providers or even healthcare access in their community. So we can use technology to bridge those gaps, and that's really where my interest started.
Right. So, I mean, you rightfully, said, I mean, compared to other industries, for example, finance, IT, and retail, healthcare, we do lag by about what the data shows 10 to 12 years, sometimes even 15 years in terms of large scale adoption of transformational technology, be it digital data analytics, and I guess most recently, artificial intelligence and machine learning. So, why do you think we physicians generally are slow to adopt this cutting edge technology? I mean, is it the healthcare culture? Is it our fear not to make a mistake? Is it our collective unwillingness to adopt to market changes? Or, I mean, is it something else? I'd love to hear your thoughts.
So, medicine is hard.
It is, sure.
And we spend so many years training to be doctors, and that training includes seeing patients and putting all of our skills into diagnosing and treating patients, and so much of that is being in the room with the patient.
So true. Yeah.
We don't get training in technology-based medicine, which hopefully is going to change in the future, or is changing now. So I think it's something that physicians are generally uncomfortable with, being able to see and diagnose and even treat patients remotely is foreign to most physicians. So it feels a little uncomfortable. It's also another technology thing that we have to learn in medicine. A lot of us remember paper charts before we had electronic medical records. So this feels like another thing that we have to learn how to do as providers. So that's hard. And then also there's the financial impact that this could have on a practice, because it's you have to invest in software and hardware and licensing for the equipment that you have. And so that is something that is a barrier for some practices in adoption.
Right.
And then lastly, I think providers also have some trepidation about cybersecurity and the potential risk of losing their patients' or data, or having that data used maliciously.
Mm-hmm. And that's a big concern now that there are so many hacks and where the data is compromised, be it from hospitals, banks, or other places, right? Yeah. So I was really sort of struck by your initial story, how you got into asthma, and obviously growing up in areas where access was an issue, and that probably explains all your passion for that. So in your mind, what are the top three challenges in bridging technology to bring these to our patients' doorsteps?
Well, number one, I think, is internet and broadband access. That is one issue that we have all over the country, and in particular in rural areas. A lot of our patients and families do not have access to internet. They don't have good Wi-Fi services, or they may not, in some instances, even have smartphone technology that would allow them to connect to a provider. So I think that is number one. Number two would be problems around reimbursement. So we don't have a national strategy on reimbursing for telemedicine services. So every state is a little different. They have things that are approved in. We have things that are approved in one state, but maybe not in another state. And there are also inconsistencies across across payers.
Right.
Insurance
Yes.
companies pay for different things. And Medicaid may pay for something, or Medicare may pay for something different. So that is definitely a barrier. And then provider uptake, as we mentioned earlier, is another barrier. I do think that if we have a silver lining out of this whole pandemic, we are going to be light years ahead of ourselves, because providers have adopted out of necessity telemedicine, so that they can still take care of their patients.
Yeah, no, that's so true. And this sort of leads me into my next question, which sort of ties in very nicely. So obviously the pandemic, which shall remain nameless, brought a renewed urgency to digital health, and obviously, as you mentioned, rapid adoption, which is I hope there'll be better strategy across the country with more funding. So from a clinician standpoint, other than asthma, especially for a primary care physician, what are the top three areas which could potentially have the greatest impact, primarily within the pediatrics?
I think in pediatrics, there's so many, but if I have to narrow it down to three, I would say number one would be around behavioral health.
Yes.
We have a significant disparity in access to behavioral health in Arkansas in particular, but probably across the nation. Those behavioral health specialists are just not, we just don't have enough to see the patients. And it is a huge burden on our primary care providers to provide behavioral health services without the support of people with that special training.
Right.
The second, I think, would be around obesity and metabolic syndromes. It's so prevalent in our pediatric populations, and we don't have support for pediatricians who may need, a consult by an endocrinologist or a dietitian to help with a meal plan, or an exercise specialist to help with, that aspect of treating obesity. So I think utilizing telemedicine would help us to bridge that gap and have those specialty services available for pediatricians to support their practice when in treating kids with obesity. And then another area is probably, I would say, perioperative services. So a lot of times kids that need surgical intervention, or their pediatrician may think they need pediatric surgical intervention. The kid has to come here for a pre-op exam, they have to come here for surgery, and then they have to come here for a post-op exam. And that may be 3 days or more that the family is missing from work, or the child is missing from school. And many times a surgeon can look 5 minutes and make a decision. Yes, we need to operate. No, we don't need to operate. And that can be done via remote visits. And then after surgery, the same thing occurs. The patient may travel 3 hours for the surgeon to say, yep, that's healing up nicely. Keep doing what you're doing. So that certainly could be done remotely.
Right. Now that's, for somebody who has to travel 2-3 hours and, taking a day off, single parents, it's not just a hardship, it's also financial hardship.
Absolutely.
I can imagine that. So I'm so glad we're talking about this, social determinants of health, because, they are so important. And, sometimes we just, at least from our standpoint, I feel we don't put a whole lot of emphasis. And clearly it's understandable, a lot of those things are not in our control. But, clearly these determinants are major factors that contribute towards healthcare disparities amongst minorities, people of color, and obviously disadvantaged segments of society. And, we hope that digital health can be a useful tool to bridge that gap in terms of bringing access. And obviously there are challenges because, some of those patients or some of those population have their, they just don't have the ability to afford, as you just mentioned. So the question is, how do we strategically bridge this gap so that we can leverage it to improve the outcomes?
So, well, as you mentioned, there are definitely significant potential in utilizing telemedicine,
right.
But so many challenges as well. I think one thing that we really have to advocate for is changes in policy and the reimbursement structure for telemedicine and mobile applications and other forms of technology that help us, or that have the potential to help us take care of patients.
Sure.
So if it's easier for it to be reimbursed and paid for, I think patients will, and as well as providers, will use it and feel better about using it, without that financial risk.
Right.
I also think that we need to engage our patients in helping us figure out innovative ways to get that technology to them. I think, again, the pandemic that will remain unnamed has really brought to light some of these disparities. around education, because we have children who need to go to school but may not be able to go to school in person. So we now have some families that drive their cars to be near schools or other businesses so they can utilize the Wi-Fi. So I think engaging communities and patients to figure out ways within their community to how they can utilize those resources. So we may not be able to get broadband internet in every household, but we certainly can get it in every community so that children can benefit from those services.
Right, right. So talking about the pandemic that shall remain unnamed. So, I mean, over the last 4 or 5 months or so, I mean, it has clearly changed our lives at home, at work. I mean, essentially everywhere. And you're a busy clinician with school-going kids, and during this time, what are your biggest challenges, and how did you deal with them?
Well, there are a lot of challenges. I think the biggest one is being able to continue to work while making sure that my children were able to attend school virtually. I have older kids who, in theory, should be able to wake up
They should.
and go to virtual school. However, they are kids, and so that's a challenge. And I think it's an even bigger challenge for people with small children who have to be supervised 100% of the time.
Right.
Some of the things that I've done, I've tried to arrange my schedule. Of course, now it's summertime, so I don't have to worry about it as much. But during the school year and this upcoming school year, trying to arrange my schedule so I'm strategically at home at critical parts of the day.
Yes.
To make sure that they get started with their assignments. If I have to come or when I have to come to the hospital, that they know, my kids know what they're supposed to do and check that list off when I get home. Also, I'm fortunate that that I do have a spouse who is able to do that also. So we tag team a lot with our kids. I think it's a bigger struggle for single parents, especially those with small kids who don't have the option to leave their kids at home a couple of hours or for a half day while I go run to do clinic or do something at work. So I do think, again, that something that we as a community need to really evaluate. How can we support each other through this pandemic?
Yeah, that's going to be critical. And, very similar experience with me. I've got high school and then another one who's ready to go to college. And even though I make the college student be the quote unquote paid tutor, it still doesn't work.
Mm-hmm. I know. Well, I've had to circle back home a couple of times and say, get out of bed. It's time for school.
All right, no, that's great. So similar challenges. I think it's just going to be an ongoing struggle. So let's end with an inspirational quote and something that gives us all the push that some of us, including myself, actually, I need it quite often. We need it from time to time. And I was recently reminded of this beautiful words of wisdom from Maya Angelou, and I quote, "You cannot use up creativity. The more you use, the more you have it." Unquote. So the question is, do you have any recent favorite quotes, and what does it mean to you?
Well, I definitely love that quote by Maya Angelou. The one that I have is "Live in the moment."
Oh, great.
And I have really, like many people, struggled with this whole pandemic, worrying about what's going to happen. When is this going to be over? How am I going to do X, Y, or Z in the future? And so I had a really wise person tell me just recently, you can't worry about the future. You can worry about the future, but you really need to live in the moment. The past is gone. We can't change that. And the future is not guaranteed. So to have peace of mind, live in the moment.
I love it. Live in the moment. That's going to be one of my favorite one too. I'm going to print it and put it in my office. So Tamara, thank you so much for your time today. I mean, I definitely enjoyed hearing about your ideas, how imposition of technology, digital health could improve and narrow the healthcare disparities, something that, at times we tend to overlook. So this podcast has been a joint team effort with Arkansas Children's Process Improvement and Strategic Marketing. And together we want to thank our audience for listening. If you haven't already done so, please subscribe to the podcast. And if you have already subscribed, thank you. If you like this podcast, please feel free to share with your colleagues and friends on social media in this age of social distancing as we stay 6 feet apart with our masks on. Until we meet again next time, stay well, stay safe.